Hello, everybody. Thanks for braving the weather to be with us. As a part of our ongoing effort to get low-level drug offenders off the streets and into treatment, I'm proud to partner with the San Diego Police Department to launch prosecution and law enforcement assisted diversion services, also known as PLEADS. We're making this announcement today at the San Diego Central Library here in East Village because public libraries are experiencing ongoing problems with intoxication and illegal drug use on their premises, leading to bathroom closures and heightened security concerns. As a young girl, I loved more than anything going to the library with my mom. Now that I'm a mother, I want to recreate that same enriching experience for my own children. PLEADS will help us ensure that libraries remain safe places where families can go, spend time together, and learn. PLEADS is a voluntary pre-booking diversion pathway that allows individuals suspected of being under the influence of a controlled substance to avoid prosecution and jail time by agreeing to seek support services. Instead of perpetually prosecuting individuals who are addicted to drugs, we wanted to help them get to the root of the problem. PLEADS gives people a chance to escape the revolving door of the criminal justice system, begin their recovery from addiction, and build a better life for themselves. We created PLEADS with three primary goals. First, to divert low-level drug offenders away from the criminal justice system and to connect them with support services. Second, to save an estimated $1.5 million tax dollars each year on time spent by police, attorneys, the court, sheriff staff, jail staff, and judges processing individuals for being under the influence of a controlled substance. And third, to reduce recidivism, allowing police officers and prosecutors from the city attorney's office to focus on other public safety priorities. I'd now like to introduce Captain Scott Wall to discuss the details of this program and how his neighborhood policing division will be handling PLEADS referrals. Captain.
Good afternoon. First off, I'd like to thank the City Attorney's Office for their help in piloting this, or developing this program, and also for the Mayor to help find the funding that's needed for it. I can tell you there's nothing more frustrating for police officers when we have community concerns and calls for help, and we don't have the tools we need to do this job to solve problems. This program has the opportunity to have an immediate impact on those that are suffering from some of the most severe cases of drug addiction. We're very pleased at our initial results that we're seeing. In the last week, we've had 9 people admitted to the sobering center. 6 of those 9 have already agreed to move forward with help in rehab services that are available. That's 2/3 of the folks that we brought in. Those are some very optimistic numbers, and those are 6 folks that would not be in help and services had this program not been available. So we're happy in the Neighborhood Policing Division to be starting this program for the police department, but we really hope to grow this department-wide so that police officers throughout the city have a place to take folks that are suffering from severe drug addiction. So again, thank you very much, and I'll hand it back to the City Attorney.
Thanks, Captain Wall. PLEADS is funded jointly by the City of San Diego and the county. We're grateful for this partnership, and we'd like to welcome Luke Bergman, Director of County Behavioral Health Services, to say a few words.
Thank you so much. Thanks to the City Attorney's Office, Police Department. This reflects the kind of partnership that can really multiply the impacts of everything that we do. And so hopefully it will be a model not just sort of for best innovative service delivery, but also the kinds of entities that can come together to really help one another and help our community more generally. Substance use disorder is, of course, one of the most deadly and difficult to treat chronic illnesses that we face. And part of why it's so difficult to treat is people who are often most suffering with it don't want treatment. The disease of substance use disorder is very stigmatized. The treatment for substance use disorder is also very stigmatized. And so what that means is that in order to get the approximately 90% of people with substance use disorder who aren't accessing treatment, in order to get that sizable population into care, we need to make treatment and services as accessible as possible at every touch point that we can have with folks who need this kind of care. We need to offer it and make it accessible. PLEADS does exactly that. We anticipate it having a significant impact on getting folks who may be most resistant, least interested in seeking care, a pathway to care that will result in really positive long-term outcomes. So again, we at the county are really excited about the service, about the partnership that has borne it, and are eager to see ongoing data collection demonstrating its effectiveness. Thank you so much.
Well, thank you. That concludes our press conference, but we're available to take some questions if you'd like to ask anything. Yeah.
Regarding the public drugs at this library and library design, so will there be an emphasis on police kind of an uptake of these at libraries to get drug issues out of libraries? And where, when a police officer comes to handle a where do you take that from?
So that's a great question. As the whole goal is to try and get to the locations and the places throughout the city to have an immediate impact on those that are suffering from severe drug addiction. Today it might be at the library, tomorrow it might be at our beach communities, and another day it might be in another part of the city. This program allows us to go wherever those problems are at and have that immediate impact with really providing a safe environment in places like our libraries and getting folks to the help that they need and really crossing through those barriers that oftentimes are getting in the way of getting the proper help. So.
Yeah, thank you so much for raising that. So May is Mental Health Awareness Month, and you know, it's wonderful that we have a month that is devoted to raising awareness of these issues. Of course, these are issues that people are struggling with day in and day out. I think what we see right now generally is a heightened awareness of these issues in San Diego County among folks who work in the county, among folks who work in the nonprofit and private sectors, and of course among our city colleagues as well. So I think that this represents the leading edge of a much larger body of work that I think we have a sort of signal, almost generational opportunity right now to address. Yeah. So I would not say that seasonal changes are having a really significant impact on the attention that this issue is getting. I think the heightened attention right now does reflect a convergence of issues. Certainly homelessness, the conspicuousness of homelessness, I think has helped raise awareness of the significance of mental illness, but then also, all the efforts that we have all been making actually for quite some time to elevate this conversation, I think, are just now bearing fruit. So what we see with substance use disorder is the frequent cycling of epidemic curves. And we have been in an opioid epidemic, of course, that has gotten a great deal of attention. It sort of plateaued in 2017, 2018, when about 70,000 people across the country died. A lot of what has given rise to this program is the significance of that coupled with, of course, the significance of alcohol use. So the year that 70,000 people across the country died of alcohol use, 90,000 people died, 70,000 people died of opioid use or opioid overdose. 90,000 people died from alcohol. So that has been a long-standing issue that I think we have an opportunity now with this heightened awareness to really sort of embrace and make some inroads in.
Tell us more about the treatment program. Are you giving the person an array of treatment choices, or are you contracting with one treatment provider?
So we are contracting with McAllister to run the center where people will be transported to. The really wonderful thing about this program is that that connection then enables the very sort of thoughtful navigation of people coming into that center to the appropriate service for them. And that's really critical. There has been across the country for too long sort of a one-size-fits-all approach to drug and alcohol treatment. And now, largely in association with the drug Medi-Cal organized delivery system work that the county is engaged in, along with many providers within the city and county generally, and in collaboration with the state. There is a more evidence-based approach to drug and alcohol treatment, and this takes full advantage of that. So. No, the McAllister component is a stabilization, to some extent, component, which then allows for the thoughtful navigation to other kinds of care that could include residential services, or could include ambulatory services, could include medication-assisted treatment for opioid use disorder, et cetera.
While they're at McAllister, they're in a residential setting?
No. This is not a setting in which we anticipate people staying for long periods of time as they would in a residential program. No, it's a relatively short duration, around 4 hours or so to stabilize people and navigate them to ongoing care.
Well, oftentimes, police officers are getting radio calls, or they might just be driving down the road, coming into contact with those that are under the influence of drugs. This is a sobering center that allows us to take them to a safe place outside of the criminal justice system. The whole intent is to try and divert folks that are suffering from drug addiction, keep them out of the criminal justice system, while also getting them help to get their life scored away. So we're happy to be a part of this. This is really an excellent tool for police officers. It is a very minimal amount of paperwork, very minimal amount of time out of service, which is extremely important. We're not making things more difficult to get people help. We're improving the ability for us to help folks. So that's a win for us. That's a great question, Gary. Yes, we're very proud, obviously, in the Neighborhood Policing Division to be starting or piloting this program. The goal is to get it out to all of our police officers citywide. As we work through some of the nuances with any new program, it's better to have it under one chain of command for now. But we quickly want to expand that department-wide. And our homeless outreach officers absolutely can take folks. This is exactly what they're designed to do. We do it already with our SIP program, our serial inebriate program, and this is going to partner or coincide with that program very well. That's well, there's a little bit of training that we've done with the city attorney's office to make sure we're all on the same page and working also with the sobering center. But all police officers are trained on symptomology and drug recognition, so that part of it is already in place. It's really just making sure that we are filling out the proper forms, that we're taking them to the proper location with the proper symptomology to help get them going in the right direction. So it's very minimal, which is a good thing. Correct. May 1st? So it's a sobering center just like detox is for alcohol. It's a safe place where we can make sure folks aren't hurting themselves, aren't hurting somebody else. But at the end of that time period, they are free to leave. There is no criminal prosecution. Our focus is if they're back out on the street and they're high again, we're going to take them right back to the sobering center, and we're going to keep doing that and give them every opportunity to get the help that they need. So we see that as a big improvement from what we have today. We spend a tremendous amount of time trying to force a criminal prosecution that has very little sticking power. So this is a step in the right direction, and it is also a reduction in the amount of time it takes for us to get people to help. So that's a big win for us.
Talked about the revolving door, someone had already street level. Have officers who come and see the same student over and over, and they're in jail for a couple of days, and they're back on the street again. Do you have any stories about that?
Well, this is a program that helps bring resolution. When we have that revolving door, it's frustrating for everybody in the criminal justice system. It's frustrating for everybody in the community. This program gets them in front of those that are professionals, that know how to deal with folks that are under the influence and suffering from these addictions, and really wrap the appropriate approach to each individual. Everybody's got a different way of connecting. So this is a great place for us to take people back and not have to spend a tremendous amount of time doing it, and really connect people to the help that's available.
So when they do, they're there for 4 hours, sober up, and then they have resources there if they want to go further.
That's correct. And just to reemphasize what we talked about earlier, out of the 9 people that we brought in, 6 have already agreed to take further help and move on to the next step. I think that is amazing. I don't know that I would have predicted it to be that successful that fast. It's really very optimistic to see those kinds of positive numbers that early.
Speaking of numbers, what is the funding for this program? And is it only funded for 1 year from the city and the county?
You want to address that? The county. So the funding is to both the city and to the county. I believe it's $700,000 or
City's portion is $350,000.
so. And I believe the county is the same. So together it's 700.
County's kind of,
Actually, come on up. I'm going to put the guy that knows far more than I do.
the city has funded the city's portion of it for 2 years, and for this pilot program, the county's portion really is kind of whatever they've dedicated to some of these services, because once somebody gets there, as Dr. Bergman announced, they will get sent to several choices of county services. So it could be any number of, so whatever that cost may be. And these are services that are already available to individuals, but we're handing them right straight to there. So
So around 700,000?
if you like that number, sure.
No, I need to.
That's why I didn't give an exact number, because I don't know what the county's exact number is. I don't even think the county can probably answer that specifically without saying, whatever cost for each program that they do, right?
Yeah, so, I mean, we can get back to you with specific numbers regarding that. So, we do hold contract with McAllister that is running the center, and so there's a distinct component of funding that goes to that. And then that's exactly right. People would be navigated to other services, and so through combination of Medi-Cal, where there's opportunity, or county funding, those services would be paid for as well.